I'm also going to go ahead and demonstrate how to connect the blood pressure cuff. Starting in 5, ready to start the assembly of the mannequin itself. All we really need to do is attach the legs, and this is the condition that the mannequin should be in when you start this process. But right off the top, I'm going to go ahead and show you how to attach the blood pressure cuff to your mannequin. Here on the left side, you'll see that there are panels, and these are basically the way that you feel the pulses, hear and I always pronounce this wrong, the Karkaroff sounds of a blood pressure here, and then a radial pulse. So radial pulse and a brachial pulse here. Here is the specialized blood pressure cuff that comes in the box that you saw previously, if you watched the unpacking video. It is a standard BP cuff, except that it's been modified with this hose that allows the link box to literally feel the pressure that's against it, that's in the blood pressure cuff itself. But other than that, it's a standard blood pressure cuff that you'd have at the hospital or in a healthcare setting. It has a big red tag on it that tells you that it's not for clinical use. Make sure not to take that off. We want to make sure that any inspectors or anything like that know that we're not using things for mannequins on people. Now, as far as connecting this is concerned, I'm just going to set this in his abdominal cavity here just for convenience and to keep it out of the way. The blood pressure arm is on the left arm of a Kelly and on the right arm of an Ann. You'll see that in a different video. Basically just connects to a small hose that comes out of the upper left flank in the axilla of the mannequin and just gets clipped in just like that, little just very small turn, and it clips it right in. And then for me, just so I don't knock it around and it stays safe, I like to just put the blood pressure cuff on. Make sure that the clear tube doesn't wind up underneath the blood pressure cuff. And you're ready to take blood pressures. Alright, so there's that piece. Next we're going to talk about putting a leg on. And I'm only going to do one. It's an identical process on the other side. This is an injection pad. We do intramuscular injections here. You can also do sub-Q fairly well with this. It's a little tough skin, but it does do the job. What you need is, obviously, the leg itself. This is the toolkit coming out of its toolkit and hardware kit coming out of its bag. You have a screwdriver, which is reversible. You can take it out. It's a straight-headed screwdriver now. Take it out, turn it around, put it back in, and it turns into a Phillips head screwdriver. Next is a nut driver, which is, of course, perfectly measured so that it fits the nuts on our mannequins. Next is a pair of pliers. Haven't had a big reason to use a pair of pliers recently because the nut driver does the job just fine, but obviously you could use this on these nuts. Sometimes after these have been used for a while, even if you keep the pelvic pin in place, after manufacturing it begins to want to spread. The pelvic pin holds it in place, but I have found it necessary a few times to use the pliers to pull this out, because it does get tight over time. You'll notice that here are the two extra pelvic pins that I promised you. And there are two locking wing nuts, and I'm sure a Laerdal representative could tell me why these are in here, but I haven't found a use for them. Although I think it might be for the head assembly. There's a locking wing nut in the head assembly. But as long as you take care and don't abuse the neck of the mannequin too much or the head of the mannequin too much, I don't think there's going to be much of a chance that you're going to need to replace anything there. Okay, in the hardware set, the two other things that come are hip assemblies. And this comes with a long bolt, and then two washers, a spring, and a nut. Now, one of the things that's very important is that you utilize your important owner's manual as a guide here, because here is the directions for use for the Nursing Kelly, and it includes how to put a leg on. And it's right here. And it actually tells you remove belly plate from mannequin skin to locate hole in hip. And the hole in the hip is right up under here. It comes through this slot here and comes out inside the abdomen here. Remove the thigh injection pad. That's this here. Go ahead and take that away. And now I actually think you can see on the video that there's a hole there. It'll say slide the spring and small washer over the bolt, and those are here. The washer goes on first, or no, I'm sorry. Yes, the washer goes on first, and then the spring. So we wind up like that. Insert bolt through hole in the thigh. Make sure you can see that. And actually I was wrong. It was right. You put the spring on first. So let's do this again. It should look like that. Sorry about that. Doing this in one take, so you get to see my mistakes right along with me. Go ahead and insert this through the hole. Winds up like that. Now we insert the bolt through the hole in the pelvis, and I find it helpful to kind of hold the bolt with my thumb nice and steady so that I can address, basically just send it right through and it'll come right out that hole. There's not too many other, there's nowhere else for it to go. Then take the large washer, put it over the bolt on the inside. Then get your wing nut and tighten it on the inside. And again, I'm not filming this because it's pretty self-explanatory on the inside. And then tighten it down. It is essential that you do things as far as the components in the right order. So washer over the bolt, then the spring, or I'm sorry, the spring over the bolt, then the washer, then insert, then put the washer on, and then the wing nut. Because what that does is it allows it to have those washers to push against, so it isn't pushing against the plastic, because that could crack. It distributes that pressure. And now, your leg is on and capable of range of motion.